Everybody wants to save money. So like, well, I'm just going to get this boil tray. I'm going to make my own whitening tray. That's what I hear from most people. I'm going to get my own whitening tray, and then I'll get gel off the internet for $10, and I'm going to whiten my own teeth. I don't want to have to pay for professional whitening. Well, the thing is when they put the gel they buy on the internet in the whitening tray, the whitening material goes everywhere. It goes on their teeth, it goes on their gums, it doesn't really go where it needs to go. And then they come to their friends and they say, well, I tried whitening, it doesn't really work. Well, the reason why it didn't really work is because it wasn't done properly. And a custom-made tray, which only a dentist can do, is specifically designed for the whitening material to go in specific spots on your teeth that need to be whitened and away from your gums. If you put carbamide peroxide or hydrogen peroxide on your gums, it's going to hurt. It's going to hurt. It's going to make your teeth hurt. But so a lot of people trying to save money, well, number one, they're going to waste their money trying to do it cheap. Number two, it's not going to work. And number three, it's going to make their teeth hurt. So I try to explain to patients when they come in, if they really want their teeth whitened and they want it to work, they really should have a custom tray made. And that's just real simple. We take an impression of their top teeth and their bottom teeth, and we send it to a lab, and they make the custom tray, and it works out great. They put the gel in at night, they wear it to sleep, and it works great. Now, there's a couple other kinds of whitening. In fact, Opalescense, which is the best whitening product out there, they do sell pre-made trays. So yes, you can get the pre-made, the Crest white strips, in effect. You can get that professional strength. It doesn't work as great. In fact, when I go to dental meetings, I talk to the rep and I say, look, it really doesn't work that great. And they say, we know it works okay, but it's for people who don't want to have impressions taken of their mouth. Because there are people who just come to the dentist and I say, look, for whatever reason, I don't want you to take an impression of my teeth. I have a gag reflex, I have claustrophobia, whatever. So for those people who just can't have impressions taken of their mouth, the professional strength white strips work okay, but they don't work great. Or they could have the, I call it accelerated whitening. They could sit in the dental chair and we could whiten their teeth for them. Now, it doesn't get you all the way there. They used to call it 1 hour whitening. And then they also used to have the, you've probably seen the laser. People used to call it a laser. It's not really a laser. It was just a blue light. And statistically, they've done all these research studies, and the blue light doesn't do anything. It looks cool, and patients, they think it works, but in all honesty, the blue light really doesn't do anything. So they've done research, and if you have a patient and you put them under the lamp for an hour with the blue light, and you put another patient under with no light, it does the exact same thing. So anyways, we could do it for you if you don't want to have the impressions made. It's a little more expensive because you're paying for the dentist, for my time and the assistant's time and so forth.